The wisdom of well-being. Rethinking health after 70. So picture this, sitting on the edge of an exam table, the paper gown crinkling with every small shift of your weight. The air is cool and it smells faintly of antiseptic. You've done this for years. The annual checkup. And hey, it feels like a responsible, proactive thing to do, a way to stay ahead of things. But as you wait for the doctor, have you ever felt a quiet question bubble up, a feeling that maybe, just maybe, this familiar routine isn't the whole story of your health? What if some of the tests we're being taught to rely on could actually be leading us down the path of unnecessary worry, invasive procedures, and treatments that chip away at our quality of life without adding a single day of joy? There's a hidden truth buried in the science, one that most doctors are too busy to discuss. So you see, up to 37% of medical tests for seniors can lead to a cascade of interventions that you never needed. Today, this isn't just about neglecting your health, or it's more about embracing the wisdom. We will explore 5 common health checkups that after 70 can often cause more harm than good. And we'll start with one that seems completely harmless, but can fill our later years with unnecessary fear. Let's start with number 5, and it's the bone density scan. The number that creates fear, and it sounds so simple, doesn't it? A quick, painless scan, no needles. You walk out with a number that tells you how strong your bones are. But here's what they don't tell you about that number. You see, most people for over 70, this number will always show some bone loss. It's a natural part of aging, just like wrinkles or grey hair. Yet, this completely normal result can trigger a cycle of fear. Let's take the story of Rose, a 76-year-old retired piano teacher who had magic in her fingers and spring in her step from her daily walks. And she'd never fallen or broken a bone, but after the routine scan, she was told that she had osteopenia, a mild loss of bone density. The doctor immediately prescribed a medication known as bisphonates, meant to strengthen bones. Within 3 months, Rose developed severe reflux and jaw pain, the side effects linked to the medication. She stopped playing the piano altogether, not because her bones were weak, but because the medication affected her daily life. A naturopath specialising in senior health suggested a different approach. They replaced the medication with vitamin D, supplements, assistance band exercise program, and a calcium-rich diet, including leafy greens. And then within a year, Rose was back at the piano. Her balance and strength had improved, and she had experienced no further fractures. Rose's story shows that not every test result needs aggressive treatment. A supportive health plan that focuses on lifestyle changes can make all the difference. Now let's look at number 4, the brain MRI for mild forgetfulness, the picture that creates panic. We've all had moments when we've walked into a room and forgotten why we're there, or the name that's on the tip of our tongue's lips, the tip of our tongue, and it vanishes. And it's easy to fear these moments as signs of someone with a more serious, like dementia. And doctors often respond by ordering brain MRIs to provide clarity. But here's the uncomfortable truth. In people over 70, these scans almost always reveal harmless age-related changes, like slight shrinkage or small white spots, often described as white matter changes. They're normal for an aging brain, the neurological equivalent of wrinkles. However, when these routine findings are labelled as abnormal, they can provide unnecessary fear and lead to invasive follow-up. Consider George, a 74-year-old retired engineer. Frustrated by occasional forgetfulness, he agreed to the MRI scan, and it showed harmless changes, typical for his age, but the report frightened him. He became so consumed with the fear of dementia that he stopped driving. He stopped attending church and socializing with friends. Ironically, anxiety worsened because of his memory. A generic psychologist ran simple cognitive screening tests which revealed that George's memory was perfectly normal for his age. And the psychologist explained that results of his MRI were nothing to worry about. George focused instead on improving sleep, hydration, and brain stimulating activities like puzzles and card games. And within months, his memory had improved. And so did his outlook. So unless there are sudden severe neurological symptoms, many health professionals agree that a basic cognitive test is often is the first step, then a MRI filled with ambiguous findings. Now, number 3, the cardiac stress test, the test that can break a healthy heart. Feeling winded on a steep hill or a bit more fatigued than usual can send you to the doctor, where the cardiac stress test is sometimes offered as reassurance. However, for seniors without clear heart disease symptoms, this test carries a concerning false positive rate as high as 40%. False positive can lead to unnecessary and invasive interventions, including angiograms, stents, or even bypass surgery, none of which improve the quality of life in those without heart disease. Raymond, a healthy 75-year-old retiree, learned this firsthand. A lifelong walker, he mentioned feeling slightly fatigued after hills, and his doctor ordered a cardiac test, which led to a series of follow-up procedures. A mild blockage was found and a stent was placed. That same night, Raymond suffered a severe reaction to the dye used during the procedure, resulting in kidney damage and a 6-day hospital stay. A cardiologist later reviewed Raymond's case and determined his fatigue was likely due to dehydration, not heart disease. All he needed was better hydration and rest between meals, not a cascading series of procedures. Now, for many older adults, less invasive alternatives like resting, EKG, cardiogram scans offer enough insight into the heart's health without risk. Now, number 2, the colonoscopy. After 75, the PrEP that poses the peril, and they are a critical tool for preventing colon cancer. But after the age of 75, the risks of the test often outweigh the benefits, especially for those without symptoms. The PrEP, a powerful laxative, can cause dehydration or electrolyte imbalances. Sedation carries potential risks for the aging brain, and the procedure itself increases the risk of complications like bleeding or perforation. Now, Dana, a 73-year-old grandmother, underwent a routine colonoscopy, despite no symptoms and a clean medical history. During the procedure, a small polyp was removed. That night, Dana woke with excruciating pain. The procedure had caused a bowel perforation. She was hospitalized for 9 days and struggled with her health for months afterwards. Many nutritionists and healthcare providers now recommend non-invasive stool tests like the FIT, which are safer alternatives for screening after 75. These tests catch most concerning cases without putting the patients at unnecessary risk. One on the list, the full-body CT scan that sells fear. These scans are marketed as the ultimate preventative tool capable of catching hidden problems. But here's the reality. These scans expose the body to immense radiation, equivalent to 500 chest x-rays, and are now estimated to cause up to 5% of all future cancers. Marcus, an 80-year-old martial arts instructor, signed up for an executive health package. The scan revealed a harmless 3-millimeter lung nodule, but it set off a spiral of tests and a biopsy. The biopsy collapsed part of his lung, a serious complication for someone that never posed a risk. Radiologists and primary health care doctors often caution against full body scans for seniors without symptoms. The risks far outweigh the benefits. So in conclusion, choose wisdom over worry, consult trusted health professionals, ask questions, explore alternatives before saying yes to routine tests. Prevention is about partnerships with both you and your healthcare team and day-to-day habits that make the biggest impact on your life. Live wisely and vibrantly without fear. All right. Hope you enjoy.